Hi. So I want to tell you a story about a lady who was a patient at the practice that I worked for before I was working in insurance, and this is just an example of how our system fails our people. So I was the office manager. I did everything at first: front desk, secretary, whatever you want to call them, in a mental health practice. I'm there one day working, and this lady comes in after her hospital discharge, and she wasn't looking too good. She was all kind of disheveled. Her clothes were a mess, her hair sticking out everywhere. She was kind of fidgety too. She was not really, she was kind of moving around a lot, kind of standing up and sitting down and being loud and aggressive. She kind of scared me a little bit, but she didn't do anything to me. She, eventually the doctor came out, got her, and took her into the room with him, and her visit was fine. Okay, she left. So some time goes by, and she comes in for a follow-up visit, and I'm telling you, I didn't even recognize this woman. Her hair's fixed, she's wearing makeup, she's dressed very nicely in kind of a business type suit, and I said, wow, you look really good. And she was telling me, how she was working on her life, that she had gotten a job and some personal goals that she had set. She had lost her children, so she was working on getting her kids back. And, all the things that she was doing, she looked great. And some more time goes by, and I get a phone call, which I used to get a lot of these calls. She's back in the hospital again. She's having a fit. She's back to her aggressive, kind of scary way. She wanted to get out of the hospital. So when she got out after the second visit, she wasn't acting exactly the way she was the first time she came. The first time I met her. Maybe she had grown to trust me. I don't know. But she went on to tell me what happened to her was, when I first met her, she was on medical assistance, and that's how she could pay for her medication and get her treatment. And then she started making too much money, so medical assistance cut her off. She couldn't have her meds. And she's one of those people that has to have her medication. And so, I don't know what she did. It's none of my business, really. But she ended up back in the hospital. And I just wanted to point this out, that this is, in this case, it's mental health. But it really could be any kind of situation where somebody needs long-term, ongoing care, where their treatment and their medications help them be productive members of society, but when they don't have it, whether or not you want to call it the legal definition of a disability, it does, it may not meet that criteria as far as collecting disability, but they're still in a situation where they cannot do their job, whether it's a mental problem or a physical problem. I just wanted to say that.